I could see premature babies in incubators, and they're so tiny, so fragile, but then they're in this complex machinery with so many tubes and, injections coming in, going, and this and that. And it really kind of hurt me to see that we have so much technology, complex technology out there, but why is this fragile little creature here undergoing such invasive treatment? But you cannot blame them for feeling that, because if you do not have that kind of support, that kind of knowledge, awareness, it's also difficult.
Dr. Deborah Maufi, welcome to this podcast.
Thank you very much, Sophia. How are you?
I'm fine, and you?
I'm great. I'm so pleased to be here and really looking forward to our
really happy to welcome you. So, Dr. Deborah Maufi, you are the founder of DPM Healthcare Consultancy Services. You specialize in health information, education, and communication. One of your primary focuses is on maternal and child health, and you have almost a decade of experience in East Africa and Europe.
Yeah, correct.
And last but not least, you have been recognized as one of HIMSS Future 50 clinical leaders. So before we dive into the subject, can you tell us more about your background?
Yes, thank you, Sophia. So as introduced, I'm Dr. Deborah Maufi, and I've founded a health consultancy going under the name DPM Healthcare Consultancy. I'm a Tanzanian, but currently residing in the Netherlands, and I have a background in medicine and also business administration. So that combination led me to leave the clinical scene almost 7 years ago. So I stopped practicing as a doctor and decided to get into more community health projects, public health. Since then, my focus has mainly been on maternal and newborn health. And of course, we cannot talk about maternal health without including sexual and reproductive health and rights.
Yes.
And so this is really my primary focus at the moment. And so over the years, I've been working with NGOs and startups and projects that bring either health innovations to the community, or also health information and education projects to both healthcare workers and the community as well. The reason I'm really focused on this area is because I have a strong conviction that health information and education is really the cornerstone to a better and equitable healthcare system. So I decided to focus on that as a basis for people to actually get into quality healthcare and good health-seeking behaviors. So this is also the why I found DPM Consultancy. That's what I want to continue with. And at the moment, I'm really working mostly with startups that are innovating for maternal and newborn health and sexual and reproductive health. Yeah. So that's where I am now.
And why focusing on maternal and newborn health?
I think maternal and newborn health, it's a very special segment in healthcare and in humanity in general, because then it's really about new life.
It's where you start.
It's exactly where we start. Yes, yeah. And I think if we manage to have a healthy pre-pregnancy, pregnancy period, and also birth period, then it's a very good start to a new life. And this will reduce a lot of risks for newborn morbidity, mortalities, mental health struggles, etc., by a very big strand. So that is why I fell in love with this particular segment, because I really want the impact that you see from dealing with someone before getting pregnant, actually getting pregnant, giving birth to a new life, and then actually seeing this new life grow into a dude named Doug or something, and living their full potential. it's quite rewarding, I would say.
Yeah.
And I would like to continue to take that journey because it makes me sleep better at night as well.
Yeah.
Yeah.
And what is the biggest challenge you've observed in this field throughout your career?
So quickly, the very first thing I would come up with would be that we've had stagnant approaches. And I'm going to focus on preterm birth and prematurity in this case because that has been my area of focus in maternal and newborn health for quite some time now. And I'll quickly say that what I've noticed is that there's been stagnant approaches towards preterm birth and prematurity care for a while. And most management approaches, they focus on newborns in general. Now, don't get me wrong, there are also parents who have full-term babies also experience challenges, but it's particularly hard for parents of these premature babies since the magnitude of the challenge at hand is much more complicated. So I think what I've seen is that the innovations and new approaches to solving these problems are also experiencing a lot of barriers. So for years and years, we've been using the same approaches and still getting maternal and newborn mortality and morbidities. But as new solutions are coming up, there are also a lot of barriers that prevent them from moving forward. A quick one would be medical device regulations. Very expensive, very time-consuming procedure. Yeah, and also very complex. And so for a startup or for someone who's actually trying to solve a very big problem, these processes should be much easier. Should be more comprehensive and easier to obtain to actually bring the solution to the end user. We shouldn't really waste a lot of time in blocking these innovations. Of course, regulations are important, don't get me wrong. It's just that the complexity, the financial bit to it also makes it challenging. That's one thing I've noticed. But another thing, and most importantly, which is also a project that I'm trying to explore right now, is the mental health support of families that actually are experiencing complications or consequences of preterm birth or are at risk of preterm birth. So there's a lack of health literacy in this area, especially mental health literacy, leaving these families to struggle a lot during this time. And if a parent is unfit, not just physically, if a parent is mentally unfit themselves, it's hard for them to also care for the baby. And if that happens, then you're putting them even at more risk for mental health problems for the child as well. A lot of research has shown that premature babies, especially those severely premature, are at high risk of having mental struggles such as ADHD, anxiety disorders, social difficulties, etc. And the risk increases if the initial care is also compromised. So then you see how important it is for the parent to actually be very mentally fit and capable to actually give this child a better future.
Yeah.
So that's one gap that I found, and I thought, okay, I'm going to dig deeper into that. And that's where I am now, trying to explore further how I can make my idea come to life.
Okay. And so your goal is to raise awareness about mental health support for families, also who have lost an unborn child, and as well as for newborns. Can you give us additional details on how are you going to tackle this huge challenge?
Good question. So, like I said, I'm exploring the current landscape of mental health for premature babies. I have found that there are a few efforts, more efforts than I actually expected were out there, but also still not enough. Yes. And a lot of, in a lot of setups, I find that it's still, the mental health part is really counseling. Once you give birth, you're counseled and discharged, go home, and from there you're on your own. But there's a much bigger influence to the mental health of these families, even before conception. So I'm trying to explore the preconception mental health part.
Yeah.
And then during pregnancy as well, and after delivery, because I think if we are to start only when the preterm event occurs, we are already too late. You know, so I'm trying to push it back and starting by creating awareness to women in general, women of reproductive age, those who wish, or even if you do not plan to have a kid today, but maybe in the future you will, but it's best to actually be aware that your preconceptual health has a big impact also on your conception and your delivery as well. Every woman should be thinking about their health, yeah, whether they're planning or not planning to be pregnant, yeah. And the main reason for this is because more than half of pregnancy are not planned. And we find that unplanned pregnancy are greater risk of preterm birth and low birth weight babies. Yeah. So you see how important it is that you plan way beforehand and be mentally fit to actually carry on the pregnancy. Yeah. But also, in addition, another reason will be that we do have a lot of advances in medicine and technology and in prenatal care and all that, but we still have 1 in 8 babies are still born too early. That means we still have a lot to do. And we cannot only focus on diagnostics on diagnostic or treatment only, but we should highly focus on prevention, because already 1 baby born too early is already 1 baby too many.
The idea would be that family or just the parents would be psychologically taking charge so they can go on this challenge with support and throughout all the journey and even after the birth of their baby.
Precisely. Yes.
Oh, okay.
So I would like to, I would really like to have a comprehensive mental support tool for them, including genetic counseling, because also genetics can put you at risk of actually having premature babies. So there's a lot of factors. Also, the partner's participation in the childcare, because we know until today, unfortunately, women have the burden of childcare is highly on women than the male counterpart. Yeah. So it also involves the family as a unit. Whether it's a single parent or there's a father involved, or it's whatever kind of partnership, whatever relationship situation it is, but the support should be really comprehensive and from the entire family. So that's the kind of noise I'm trying to bring out there.
Yeah.
And hopefully the result would be either an online or offline tool at the palm of your hands that you can carry with you everywhere you go, and hopefully also be able to connect to a healthcare professional when needed.
So even if you're not pregnant or you did not plan to be pregnant, you just want to have the information, you just connect to the tool and then you just can have answers from a professional and get information from, like, for example, articles or...
Yes, exactly. Yes. And preferably also a forum, a community of, families that are going through the same.
Yeah.
So sometimes you can sort of a support group,
yes,
an online support group, and just hear what others are going through, how they tackle them. Mm-hmm. And it's good to know that you're not alone out there.
Yes.
These families come with a lot of, they feel guilty, they feel shame, they feel responsible for these actions, etc. And I think it's important if they know from the beginning that it's not their fault that this happens.
Yes.
And the best approach is to ABCD and, take care of yourself and your baby the best way you can, rather than wasting time feeling all these feelings of guilt and shame. But you cannot blame them for feeling that, because if you do not have that kind of support, that kind of knowledge, awareness, it's also difficult, It's a very fragile time.
And where would you like to start in terms of geographically? Would you like to start in where you are in the Netherlands, or maybe in Europe, or maybe in Africa?
Yeah, that's a good question. So I have a strong affinity for Africa.
Yes.
That's, I might be biased because I'm from there. But if we're being honest, Sub-Saharan Africa also has the highest numbers of premature babies, preterm births, and also mortalities related to this. Yeah. And I think if we should go where the problem is bigger, start from there. But also the resources are much more limited in those settings. The financial capacities, the insurance policies, infrastructure, also just actually having mental health support staff. That's also, there are not many of them. So I would like to start there.
Yes.
Start there, try to build capacity and also introduce these solutions to the women. It's going to be a long journey because it's really still a concept.
Yes.
But geographically, I would like to start in a low middle income economy. I think that's where the need is most. And this is not me neglecting women in the Western world or in other developed locations, but I think my affinity is more towards there. And I'd like to start in Africa.
And how would you define the success of your project?
I think if I can help one family, I already consider that success.
Yes.
However, the more, the better. The more families I can reach, the better. But more importantly, I think the success to me would really mean that the different industry partners, also actually from government to insurance, etc., actually have conversations about this and actually support efforts towards improving this. And once we get there, then it's much easier to really penetrate a bigger population and help even more people.
Yeah.
But that barrier there, the whole bureaucracy, policy, politics, insurance, financial constraints, etc., that will be a really big hurdle to cross. But I think I would consider it a success once that has been crossed and now we're reaching even more and more women. But even one woman, to me, it's already a success.
My last question is, because it's a long-term project, so you have to be, whether the motivation is here or not, you have to just continue. So what is motivating you?
That's a good question, because I personally haven't experienced pregnancy or preterm birth, or it's not like I personally care for premature baby or something. But through my clinical career, when I was working in the neonatal ward, I could see premature babies in incubators, and they're so tiny, so fragile, but then they're in this complex machinery with so many tubes and, injections coming in, going and this and that. And it really kind of hurt me to see that we have so much technology, complex technology out there, but why is this fragile little creature here undergoing such invasive treatment? There must be better way. There must be, So it really just, I think it was just mostly a feeling of empathy that grew into a passion, and the passion became the motivator. And, and then here I am today, still trying to, keep doing something better and better to make this, better. And I sleep better at night knowing that I'm doing something about it, no matter how small it is, but it's what's within my ability. And if everybody is winning, then, you're doing the right thing, and that's really my biggest motivation. I would say it's the feeling that you get from the impact that you make.
That's beautiful.
That is it, really.
That's beautiful.
Yeah,
well, thank you.
Thank you. I just made that up.
You should keep it for your quote. This is beautiful.
I should, right? Yeah, I should trademark it.
So thank you very much, Deborah, for this interview. It was very, very interesting. I look forward to hear how big a success is your project. I'm looking forward to. There may be some people who maybe want to help or have some ideas or just want to contact you. So where can we contact you?
Oh, that's great, because I would definitely like people to to actually find it and join forces. Yeah, so I'm on LinkedIn.
Yes.
I'm quite active on LinkedIn, so you can find me there as my name, Deborah Maufi.
I will put the link.
Yes, and also think my email address, because under DPM Healthcare, since I have my own consultancy, I think people can also reach me through that, and we can always. I'm very open to collaborating with anyone who either is working on something similar or is just interested in actually studying in this area like me, and or it could be also a financial partner, there's so much needed to do this, and given the lack of information and tools currently in the current environment, then there's also the research part to it. So also research partners are a great addition if somebody is doing research in this area, or somebody's interested in partnering up to actually do research together. I'm very open to so many different kinds of diverse partnerships at this stage. It's really still a concept, so everyone is welcome. Every kind of partnership is welcomed.
Well, thank you very much, Deborah. And
thank you very much.
Hopefully see you soon for a new interview about your project and about the success of your project.
Amen to that.
And I wish you the best of luck and the best of success.
Thank you very much, Sophia. It was really great talking to you today. And thank you for the opportunity, actually. It's always nice to get this message out there.
Thank you.